Invoking blessings of the Almighty and offering our salutations to Sadhguru Sri Madhusudan Sai, elders and guests, brothers and sisters, faculty and interns from various medical colleges who've joined us today, and everyone watching us live, Namaste, Sai Ram, and good afternoon. We take this opportunity to welcome the dignitaries on the dais. Avaduta Sri Vinay Guruji, social and spiritual leader from Karnataka. Dr. B.N. Narsamurthy, Chairman, Prashanti Bal Mandira Trust. Our revered founder and chancellor, Sadhguru Sri Madhusudan Sai. We welcome you all to a special program this afternoon as we all come together for a shared purpose of progress and prosperity through partnerships. Children are the future of any society, and investing in their well-being is crucial for the well-being of a nation. The Divine Mother and Child Health Program has been designed towards achieving this goal through our comprehensive screening programs. Since its launch in 2017, outreach camps have been conducted regularly for school-going children in Chikbalapur district. Designed in an integrated manner, the components of this program include anthropometry, general physical examination, screening for refractive errors, health education, and referral to higher centers if needed with follow-up. The Rajiv Gandhi University of Health Sciences has been a key partner in this endeavor since 2018. Interns from various medical colleges in Bangalore have been passionately involved in these outreach programs. This exposure to communities at the grassroots level has not only enriched their knowledge and on-field experience, but has also sensitized them to become socially responsible. In turn, these young doctors serve as role models for children at the government schools, inspiring them to work hard and pursue their dreams. I now invite Dr. Satish Babu, Director, Academics and Strategic Growth at Sri Madhusudan Sai Institute of Medical Sciences and Research, to present an overview of the program.
Sai Ram, good afternoon to one and all. Offering my humble salutations at the divine lotus feet of Bhagavan Sri Sathya Sai Baba on the occasion of 100 days celebrations. Offering my salutations at the lotus feet of Sadhguru Madhusudan Sai, distinguished dignitaries on the stage, professors, HODs, faculty who have come from different colleges to be part of this program, interns, PGs who have again come as a part of this Divine Mother and Child Health Program, elders, devotees, and our own students. Today is a memorable day. This is the second innings of Divine Mother and Child Health Program. To understand the background, how the genesis of Divine Mother and Child Health Program was started, we will look into the statistics. The major public health problem what India is facing for last 70 years is malnutrition. Affordability, availability of healthcare being another big public health problem. Malnutrition, especially in pregnant women and children, is a major public health problem. You can see the staggering and painful numbers, statistics on the slide. Almost 96 million children are undernourished, and that's more than the population of a big European country like France. If you take anemia in women and adolescent girls, it's almost 56%, and it has not budged in last 75 years. It has moved probably 2 to 3% downward rather than making a significant improvement in spite of lot of money being spent, policies being appropriately implemented. in last 40, 50 years of our independent India. On top of it, we have congenital malformations and our heart diseases, congenital heart diseases mark the main congenital defect, and almost 3 lakh children are born in India every year with congenital defects. So post 2011, the inspiration and legacy of Bhagwan Sri Sathya Sai Baba was taken in a missionary zeal by our beloved Sadguru Madhusudan Sai, and child became the focus, as was with Bhagwan Baba, and nutrition, healthcare and education became the verticals, became the initiatives, child being the future of nation. This was, the foundations were established to take care of 3 initiatives, 3 verticals, and big way, very scientifically organized way, the programs are being happening, and it has become a life cycle initiative, and to make this a reality, 5 mother and child health hospitals are functioning as of today in very remote parts of India to take care of both morbidity and mortality of mothers and children. And on top of it, we have 5 pediatric cardiac, very high-end niche specialty hospitals, giving a complete ecosystem in treating and taking care of congenital defects, including doing a research in genomic studies. So if you see the numbers, since 2012, more than 3 lakh outpatients have been, pediatric cardiac outpatients have happened, and more than 3,30,000 cardiac defect screening in rural school children has happened, and 37,000 pediatric interventions have happened. And all these have happened free of cost, not causing any added burden on the families. So this is sort of hospital-based interventions happening. What about the unanswered malnutrition, unanswered preventive aspect? And this requires obviously a community approach. So community programs were thought through and implemented, and one such big program which has to be mentioned is malnutrition prevention program, largest free morning nutrition program happening in India, and more than 1 crore children are receiving morning nutrition in this program. Parallelly, on similar lines, Divine Mother and Child Health Program was initiated, and this is a primary healthcare initiative, again with a singular objective of healthy mothers beget healthy child was the motto, and the program started in 2017, and fortunately, and I should acknowledge and express my deep gratitude to Rajiv Gandhi University, immediately, almost very next year, they supported this program, and up until COVID, the reports, within almost a year, we screened 45,000 children. In them, almost 15,000 children needed further intervention, needed some more higher care. So that was taken care. Most common, again, in this 15,000 requiring further intervention was anemia. Almost 8,000 children had anemia. Around 1,600 children had visual acuity defects. And you can imagine in a government school where the ventilation and the lighting is very dim, child having a visual acuity, what will be his academic performance? And all the children, 1,600 children, received spectacles and visual acuity correction has happened, and the reports suggest that their academic performance has improved following this intervention. Of course, COVID stopped it, and only this year with added support and their own initiative, previous Vice Chancellor, Dr. Ramesh, took up this initiative along with Dr. Raghupati to restart this program, and in January it was launched, and the current Vice Chancellor Dr. Bhagavan is completely supporting this program. Unfortunately, it's got delayed and he'll be joining shortly. So these are the numbers in last less than 6 months. 6 batches of interns and PGs have come from different medical colleges and screened almost 21,000 children. And we have not analyzed, but the pattern is almost the same because it's still ongoing. One batch of 50 interns are at the moment doing the same, doing the screening. Today morning also they have done the screening and come for this function. So once this session is over, we will analyze the results. So individual attention is given to child, and it has a threefold impact which we are continuously, repeatedly getting the feedback from interns. Obviously, they are very happy that their clinical skills are getting fine-tuned. They are becoming very fast in making a clinical decision, and that flow of examination is being fine-tuned. Of course, they are being exposed to the rural reality with medical problems, with critical issues like malnutrition, being exposed on real-time sense to the interns. And of course, the other aspect which is very soft and not highlighted usually is the rural children being inspired, seeing the doctors of their own region, their own community, coming back and taking care of them. That's as a huge sort of impact. Why I'm saying that? One girl got so charmed by one lady doctor, and she went to her and told that, I want to become a doctor like you and come back to my own village to serve like you. So these are, these children are 8, 9, 10-year-olds. That seed of aspiration, that seed of inspiration being instilled by the senior brothers and sisters of our nation as doctors is what this program is being sort of impacting the children. So with this, I again express my deepest gratitude to all the medical colleges which are part of this program. There are 12 medical colleges from Bangalore who are supporting this program. And of course, Rajiv Gandhi University is the nodal sort of university which is made this program as a formal flagship program of the university, and they have a scheduled curriculum laid out program. So we are deeply appreciate the medical colleges, faculty to take their time out and come and help us in this program. And of course, Rajiv Gandhi University being the biggest university, medical healthcare university in country, they have almost 1,600 medical institutions under them, and more than 2 lakh students at a given point of time are enrolled doing different courses. The potential is huge. You can expand this program not only to medical interns, it can be expanded to dental, it can be expanded to paraclinical and nursing aspect as well, which Dr. Bhagavan, our Honorable Vice Chancellor, is proactively looking for this program to be expanded. We had an initial discussion, so hopefully in days to come, this program gets expanded to other institutions, other districts, and pan-Karnataka to begin with. With these words, I once again extend my heartfelt welcome to all the interns and faculty from different colleges, and all the very best in your career. Thank you.
Interns from various colleges who've been a pillar of support in this program will today receive certificates of participation. As I read out the name of the medical college, I request student and faculty representatives to please come on stage and receive them. We'll begin with Akash Institute of Medical Sciences and Research Center, Devanalli. Next is Bangalore Medical College and Research Institute. BGS Global Institute of Medical Sciences. Dr. B.R. Ambedkar Medical College and Hospital. East Point College of Medical Sciences and Research Center. ESIC Medical College and PGI MSR. Before we move on, we take this opportunity to welcome our chief guest this evening, Dr. B.C. Bhagwanji, Vice Chancellor, Rajiv Gandhi University of Health Sciences. Next, we have Kempe Gowda Institute of Medical Sciences. MVJ Medical College and Research Hospital, Hoskote. Next is MS Ramaya Medical College. Saptagiri Institute of Medical Sciences and Research Center. St. John's Medical College. The Oxford Medical College Hospital and Research Center. Lastly, we have Vaidehi Institute of Medical Sciences and Research Center. A total of 13 colleges have participated. We thank you all and extend our best wishes for your future endeavors. We also take this opportunity to extend our gratitude to Dr. Vasant Shetty, Deputy Registrar of RGUHS and Chief Coordinator of the Divine Mother and Child Health Program. He has been the NSS coordinator for RGUHS for the last 24 years. We thank him for his indispensable support, which has been crucial for the program's success. Incidentally, he will also be retiring this year, and we wish him all the very best. Thank you. We now have a video presentation on the Divine Mother and Child Health Program and its impact on both children and the young doctors. May we have the video, please?
The Divine Mother and Child Health Program is initiated by our institution with the focus on providing preventive and promotive health services to mothers and giving screening programs to children. We involve the entire community in this because community participation is the essence of this particular program. Also, we focus on educating and training the new doctors like interns and postgraduates in making clinical diagnosis using only their clinical skills and also to make them compassionate doctors.
I'm Dr. Samiksha from Saptagiri Medical College. So this camp is held for 4 days. It's been a great experience already.
It's been the second time I'm coming here and feeling some positive energy after coming this camp, like interacting with children, interacting with people. I'm also learning so many things from this people and their cultures, and I'm feeling happy.
We learned how to handle these children better. We learned how the rural population suffer. We also realized how important our work is, how important our job is. We would really like to thank the institution for giving us this opportunity to come ahead and experience this wonderful program and do some service from our side.
We now invite our chief guest, Dr. B.C. Bhagwanji, to address us, please. He formerly served as Principal and Professor of Surgery at Kempegowda Institute of Medical Sciences, Bangalore. He is the first person from a private medical college to hold this position. Dr. Bhagwanji.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಈ ಸಭೆಯ ಅಧ್ಯಕ್ಷತೆಯನ್ನು ವಹಿಸಿ ನಮ್ಮೆಲ್ಲರಿಗೂ ಆಶೀರ್ವಾದ ನೀಡುತ್ತಿರುವ ಶ್ರೀ ಮಧುಸೂದನ ಸಾಯಿ ಅವರಿಗೆ ಗೌರವಪೂರ್ವಕವಾಗಿ ನಮಿಸಿ, ನಮ್ಮ ಆಧ್ಯಾತ್ಮ ಗುರುಗಳು, ನನ್ನ ಅಚ್ಚುಮೆಚ್ಚಿನ ಮಾರ್ಗದರ್ಶಕರು, ಸೋಷಿಯಲ್ ರಿಫಾರ್ಮಿಸ್ಟ್, ಅವಧೂತರಾದ ಶ್ರೀ ವಿನಯ್ ಗುರೂಜಿ ಅವರಿಗೆ ನಮಸ್ಕರಿಸಿ, ಶ್ರೀ ನರಸಿಂಹಮೂರ್ತಿಯವರು ವೇದಿಕೆ ಮೇಲಿದ್ದಾರೆ. All the other dignitaries of the dais, dear students, ladies and gentlemen. It's an honor and privilege as Vice Chancellor of Rajiv Gandhi University of Health Sciences, Karnataka, to be here on this occasion. It's an occasion where we celebrate, thank all our healthcare workers, young budding doctors, and the associated institution, Sri Madhusudan Sathya Sai Institute, organizers and authorities who have participated in the programs last couple of months in the form of Divine Mother and Child Healthcare under Rajiv Gandhi University of Health Sciences. This initiative was long back started, probably around 2018 and 19, but there was little hiccups in the earlier days in implementing the program in an appropriate way. Of late, after I have taken over as the Vice Chancellor of Rajiv Gandhi University of Health Sciences, I am very happy and pleased that such a noble work, which was started few years back, was given little more thirst, and now we have had very frequent health camps. Till today, probably we had about 6 health camps spreading across 101 villages in the surrounding area of Chikballapur, involving 261 schools, targeting approximately or reaching out approximately about 10,000 population. And I'm also proud that almost about 250 undergraduates and almost about 100 postgraduates under Rajiv Gandhi University of Health Sciences participated very actively in this program and have initiated the process of reaching out to the public. Some of you are aware, Rajiv Gandhi University of Health Sciences, which was started in 1996 with a purpose to educate all our healthcare students, had 153 institutions under its belt. Today, we have 1,500 healthcare institutions, making it one of the largest in the globe. All these years, we were concentrating on structuring ourselves to educate our youths, be it in medical, dental, pharmacy, Ayurveda, nursing, allied sciences, homeopathy, Unani, every branch of medical sciences. We have realized of late, after all this achievement, we have realized that reaching out to public, and especially to the rural mass, and also school children who are our generation next, is one of the important, should be one of the important program of our university. So last few years, we have started many initiatives, and one of them is this Divine Mother and Child Care program. As we are reaching out to the public in terms of conducting camps at the schools, recognizing their problems, it could be social problems, it could be a little bit of economic problems, and of course the healthcare problem is the mainstream. And then understanding the burden of the family in terms of health-related care? How do we make the healthcare facility to reach them? We are trying to understand through these camps. Our students are getting exposed to the rural mass, school children, wherein they can learn the art of communication, keeping sympathy, empathy, and compassion in mind. They are learning the problems which are existing in this part of the area. And also how to scale up our healthcare system. We are getting feedback from them. The main area of focus was to find out the incidence of anemia, nutritional deficiencies, other genetic disorders, communicable and non-communicable diseases which are prevailing here. All these are being given to us as a report, and I'm sure it's going to help Sri Sathya Sai Institute and Rajiv Gandhi University of Health Sciences, and this could be, the data could be shared with the other agencies at the Government of Karnataka or Health Department, and government can also come up with some initiative to accelerate the healthcare system and also make policies which are very, very important. It's health screening, preventive screening, community engagement, and medical training. All these are included in this program, and so far we have been very, very effectively implementing it. And I thank Sadhguru for really taking up this cause and also getting Rajiv Gandhi University of Health Sciences involved. In fact, today we had also requested our Technical University Vice Chancellor, Dr. Vidya Shankar, to be here. Unfortunately, he had some commitments, he would have left early. We are going ahead with a tripartite memorandum of understanding between Madhusudan Sai Institute, Rajiv Gandhi University, and Vishweshwaraya Technical University. The Technical University has the technical support. They are the people who make gadgets, softwares, the appropriate one to implement these kind of healthcare programs effectively in the rural area. We have, in a broader way, we have accepted to work together in implementing some of the new programs that our Sadhguru Madhusudan Sai is going to take up in the future to come. So probably in another few weeks, we might be signing this tripartite agreement. And I only hope such initiatives, especially in the rural area of this state, will help the society. As you're all aware, there are approximately 180,000 doctors registered under Karnataka Medical Council, but hardly around 80,000 doctors are practicing. And out of which, we hardly have 5,000 government doctors. Very less number of PHCs, probably around 2,500 PHCs for such a vast population. So how do we reach? How do we heal our society? How do we help people to come out of their problems? How do we give them the health care in their own village, not making them burden with the financial resources, traveling, so many problems. So this is the only way, through the NGOs, participation of public, in many ways, and the institutions like Madhusudan, Sathya Sai Institute, which can reach out to public. So Rajiv Gandhi University will definitely stand with the institution. Of course, this education institution is an extension of Rajiv Gandhi University because they're under us for all practical purposes. And then the programs which are going to be taken up in the future, be it an educative one for the young budding doctors or the students, and also for the society, we are going to be joining hands with them. In the last few weeks, our university also has realized it's not just the health of the public, but health and public awareness among our own students under Rajiv Gandhi University of Health Sciences. We have approximately about 2.5 lakhs to 3 lakh students and about 34,000 teachers. They are the one under a lot of stress, whether they're going through the courses or they're in the education field or the healthcare field. The stress, drug abuse, substance abuse is increasing amongst our own students. It's almost reported that it's almost about 20%. And even the stress problems amongst them has increased. Other problems like stress-related problems like hypertension is another problem which we have come across in our young budding students. So our university has taken initiative to declare all our campuses drug-free, tobacco-free, and substance abuse-free. That's the first initiative we have done. Nasha Mukt Bharat, we are working towards that. We are also, Guruji, trying to implement comprehensive yoga. We are actually working with S. Vyasa University, Dr. Nagendra Guruji, in coming up with a comprehensive yoga for all the students mandatorily. So this program is based on stress management to bring them out of drug abuse and also stimulating the brains and making them focus on the curriculum. These are some of the initiatives, and also we have a very big drive which is being announced in a few days from now. We have the meetings of all the head of the institutions under Rajiv Gandhi University of Health Sciences. I would want to bring up awareness among our own students to donate organ. So organ donation, which is really the need of the hour, we are trying to bring awareness among our own students and making them initiate themselves, take up steps towards donating organs and helping out the needy ones in this state of Karnataka. So thank you very much for giving me an opportunity to be amongst you and sharing our thoughts and the purpose in getting associated with this great institution. The way this institution is growing in this rural area and indulging in the service of the public is commendable. Rajiv Gandhi University always stands with you, Guruji. And I also thank our Vinay Guruji. He was instrumental in me climbing up to this position. He had always blessed, and he also participated in our program in the foundation day about a month back, and he has come up with his own thoughts, vision, and he has blessed. So that's also a leading light for all of us. So thank you very much. I thank Vasant Shetty, Mr. Vasant Shetty, our Deputy Registrar, for taking up this task and involving all our students, about 13 institutions and almost about 500 students in reaching out to 10,000 public in a very, very short time. So thank you very much. And Jai Hind, Jai Karnataka.
Thank you, sir, for joining us today. We look forward to your continued support and partnership to take this initiative forward so that more children can be covered in greater geographies. We extend a token of our gratitude to Dr. Bhagwanji. On behalf of everyone, we pray to our founder and CEO, Sadhguru Shri Madhusudan Sai, to bless us with his benedictory message.
सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखमाप्नुयात्. May all be happy, may all be healthy, may everyone see good and auspicious things, may no one have any sorrow. That is our prayer and that is the motto of our hospital also. While we aim at achieving universal health coverage, which has been the vision of World Health Organization to the national health policy makers, we are still a long distance from achieving it. But these are steps that are being undertaken as a collaborative approach between universities and institutions to make healthcare reach the last and the least. And for this, we are very grateful to the Rajiv Gandhi University of Health Sciences and the Honorable Vice Chancellor Dr. Bhagwan for supporting a cause like this through various institutions under the university and the various doctors, the graduates and postgraduates who are here. To all of them, a big thank you on my personal behalf as well as on behalf of numerous patients who have benefited from this program of Divine Mother and Child. Sri Vinay Guruji has already, we have been told that he has blessed the university and also a program like this. It is truly not just the physical efforts that get us success. We also need divine blessings to make anything succeed. As Sri Krishna says in Bhagavad Gita, Yatra Yogeshwara Krishno, Yatra Partho Dhanurdara. Both are required. There should be divine blessings and also human effort. Together only we can achieve whatever we want, whether it is in the field of spirituality or in social work, or for that matter in any other field. So this idea is something that is very unique to our institute because, as you mentioned, there is a high level of stress amongst the medical students. It's a very stressful job. Even the doctors, the high burnout in the doctors, and especially those dealing with emergency and critical care. So we understand how difficult their life and their job is because for them, success means the patient should be saved. Otherwise, everything is a failure. And that is so hard to achieve every single time. So it really burdens them with a lot of emotions. And that is very difficult to handle, and they take to paths to distract themselves or to help themselves. But that is not the right way, and I'm very happy to hear that you are initiating initiatives like comprehensive yoga programs for them and many other self-help programs which will help the children stay stable and balanced amidst all the challenges that they face as medical students as well as healthcare professionals. This vision of Bharat that everybody should be healthy cannot be achieved by mere prayers. It has to be achieved only through collective and collaborative efforts. We work in rural India for the last almost 14 years, from the pediatric heart care to mother and child program, and now with medical institutions, nursing and paramedical institutions. Our effort is to reach out to every single person in the country. And for that, as new initiatives, while we have tertiary care hospitals, we also are initiating secondary and primary care facilities as a hub and spoke model, where primary care can be provided to the people at their doorsteps, which would happen through healthcare professionals through paramedical training, nursing training, and also making doctors available and specialists available on call or as online on Zoom. So that is an effort that is being undertaken, and when I heard that yourself has initiated a tripartite collaboration between Visvesvaraya Technological University, the Rajiv Gandhi University of Health Sciences, and our institute to come up with solutions which are appropriate for rural India. We can't get all doctors to every single village. We can't get specialists to every single rural patient. But through technology, we can reach out to many more people. And that is something which is commendable. I look forward to that initiative where we can come out with wearables or remote monitoring devices or many other ways, even diagnostic through AI as a co-pilot model, whatever is possible to enable the rural doctors, nurses, and practitioners to do their job even better. Today, AI is a game changer in every field, and so also in the field of artificial intelligence. I will be very happy to tell you that we have been investing a lot in developing solutions that are AI-based, which could help a rural practitioner also to get the best of the advice from the, not totally on the AI basis, but at least the first step can be achieved through that. There are some softwares that are already under trial in our institute, and they're yielding very good results. I saw a video where our doctor and the software both were diagnosing the patients as a total blindfold study. And after the entire diagnosis, we came to a conclusion that up to 95% accuracy was there in the software, the artificial intelligence-based advice, including the medications that was prescribed and the dosage. That was as similar to what doctor would have done, given whatever the medicines were available. So to that extent, AI is now a game changer. Surely it cannot replace the doctors. It cannot replace human touch, empathy, and the warmth that only doctors and nurses and medical practitioners can give. But it can enable our doctors to do their job even better, especially in a very populous country like ours, where we cannot have doctors and nurses or specialists in every single place. Rural India is very large. 2/3 of India is in rural geography. And many of them do not have this health-seeking behavior. And that is another reason why we need doctors to go out into rural areas and encourage them to come for checkups and diagnostics. If they cannot come, we have to go to their doorsteps, go to the schools and prevent any health emergency from happening, because we cannot afford tertiary healthcare. And the way healthcare costs are going up in the country, it is even more difficult to provide high-quality healthcare to everyone democratically. So under these circumstances, programs like this, which are totally transformational, because children are the future of the country, and if they grow up sick and unhealthy, there is no future to the country. We will have a very unproductive population, and that's going to be a burden on this system. So to avoid that, many initiatives like this are welcome. We also have an Annapurna Saishore program, which ensures that every morning almost 1 crore children in the country receive free morning ragi malt-based meal, which is also fortified with various micronutrients that helps them to get their nutritional requirements fulfilled and avoid anemia, stunting, wasting, and other developmental delays and defects. That is also something that is succeeding very well, and we are doing a very research-based study to understand how this is impacting the rural health of the children. So also we have various variants of Saishore for pregnant women, lactating mothers, and adolescent girls. This is to ensure that we have healthy mothers to deliver healthy babies. Despite whatever efforts, there is still a long way to go to cover the entire country, especially in the remotest areas. We look forward to this collaboration, which will change the landscape of healthcare in our country and maybe even inspire other countries to take it up and do it at a scale and speed, which is the need of the hour. While we are continuing to put efforts, I urge the medical doctors, nurses, practitioners, and the future students to stay steady on their path. I know this is a very difficult study. It requires a lot, it demands a lot, but then you are the people who can save so many more people. But the first thing is that you should look after your health, both physical as well as mental and spiritual and emotional. Because without you, so many more people cannot do what they have got to do. And our country can never reach that Vikasit Bharat vision, the developed country vision, unless everybody is healthy. And health is wealth, as they say. Unless you are healthy, you cannot even earn for yourself. So you are the people who can help the country. We We are facing a lot many problems. This is just one initiative on mother and child, but in our mind there are other initiatives, especially to do with lifestyle diseases, obesity, diabetes, hypertension, and cardiovascular issues and cancers are going up every day. Not only in our country, in most of the countries of the world. So also mental wellness issues. Towards all these we want to work in a very methodical way, structured way, so that it not only is prevented, but we also have research-based data to understand what makes all these happen, including epigenetics, and then ensure that it is stopped where it is in its track and doesn't spread further. In last few months, we have heard how many breadwinners and mothers and young people we have lost to cardiac arrests. And again, if you go back, it has reasons in genetics or maybe lifestyle or due to the stress and other habits that people have developed. Many of them do not realize that they are actually having a problem because they never go for checkups, they don't go for any diagnostic tests, they don't even go and screen themselves, even if it's given free. That kind of behavior is the reason why we are suffering more. So I think young boys and girls, and they go out into the villages, knock on every door and tell them that we are here to check on you, to look after your health, and you don't have to worry, you don't have to pay anything, we are not expecting anything from you, we are just here to help you. That would encourage a lot more people to come forward and get themselves screened, whether they are children or women or adults or male, whichever way. And that would help us from preventing a lot of diseases from happening. Our country is a very large country, and it is very difficult to achieve all these things very quickly. But once we have started on the right path with right collaborations and partnerships, I'm sure this is going to be achieved sooner than later. To all those who have participated, to the staff and faculty of our institute, to the institute faculty of Rajiv Gandhi University, to all the student participants, the MBBS and postgraduate students, and everyone else who has supported this cause, my grateful thanks on behalf of all the patients, and I look forward to a very successful future partnership also, including the research on wearables and technology-based interventions in healthcare. And I'm glad that our universities are thinking in this direction, and they are making strides and taking steps to address this issue in the most scientific and the most advanced way possible. This is the way forward. While we keep our roots intact, we believe in our yoga and our traditional health systems, which have helped us all this while. We also are advancing in breaking new grounds in terms of healthcare technology and new innovations. I think that is the combination. I always quote this from DVG, who says, Hale Beru Hosa Chiguru, Kudiralu Marasubagu. The old roots and the new shoots, both are required for a tree to be prosperous. And I think our country has the old roots of Ayurveda or the traditional medicine, Siddha, and things like that. And yoga, very big boon that our country has. We must utilize that to benefit our people and ourselves. At the same time, we must be doing cutting-edge innovation and research to bring out better solutions, more scalable, sustainable, affordable solutions for the large population that we have. If we can solve India's problem, we can solve the world's problem, because India is a mini world by itself, such a diverse population. And I think India can lead the way in better healthcare, because India has the vision of Sarve Santu Niramaya. India has this idea that everybody should be healthy, and I think that is the way forward. I encourage our students also, who are seated over here, this side, they're nursing, paramedical, medical students, boys and girls on both the sides, to take a lesson from this. And when you do your family adoption programs, learn all the things that are being told, the protocols that have been created, and use it to benefit the patients, as well as learn how to do it faster and better. I'm sure with technology you can do much more, but just don't be over-dependent on technology. God has given us some intelligence. We must use that first. Technology should be a support and not the main thing. This is not good if we over-depend on that. And second thing I want to tell you, that be always mindful that the patient is a human first and the patient later. That humanness in our healthcare, the humane healthcare, is the basis of Indian healthcare system. We always treated not just the body, we just treated the person. We treated them as our own, we showed love and compassion. That is how healing happened. While the treatment happened medically, the healing happened in a more spiritual way. And our doctors were Vaidyas, Vaidyo Narayana Hari, we say their doctors were gods. So the idea is that Indian healthcare system, its ancient practices, its value system should be brought into the modern medicine. And a marriage of the two is the best way we can deal with the healthcare crisis that our country and many countries in the world are facing. Thanking everybody for their continuous support and looking forward to many more. I would like to also remember the previous Vice Chancellor, Dr. Ramesh, who was very instrumental in starting this, but we could not take it forward due to COVID. After that, we could not restart it, and now we have been able to restart. So every year, this will continue. Dr. Raghupati and Upadhyaya, Dr. Upadhyaya and others, they have always been involved, and I want them to continue this program. There are hiccups, but then we have to stay put and keep pushing and further this cause. So with these words, thanking everybody once again. Sarve bhavantu sukhinaha. Sarve bhadrani pashyantu. Ma kaschit dukkham apnuyat.
Thank you, Sadhguru. Once again, our gratitude to our guests, faculty, and interns for your presence and participation today. With this, we conclude the program. We will have a short break for 10 minutes and will resume the next segment shortly. Thank you.